And this will be working together. It will be also obviously pointing out where there are problems, but it'll also be working out together. And part of that transparency is a brand new website. And this website will allow you to click anywhere in the province of Ontario to be able to see what is happening at a home in your community at this home. What is happening? Who are the people that are working in this home? Are there infections? Are there outbreaks? How many staff are working? You'll be able to read the inspection report right there online so that nobody has to wonder or search through millions of different websites to get at what it is that their family members might be going through when they're at their home and helping you make decisions. And it is also, I think, a very, very valuable tool in helping you hold government accountable for the things that we have been talking about. As I said, you know, we're working hard to spend your money. It's not government's money. It is your money, and it is money that you have told us needs to be spent to make healthcare better in the province of Ontario, to make long-term care better in the province of Ontario. It's something that we have heard for a very, very long time. It is something that we had decided to do as a government before we were even elected. We heard about hallway healthcare. We heard about the long wait list for long-term care. We heard about how important it was to get some of these older homes and modernize them. We heard why PSWs and nurses and allied health professionals weren't considering long-term care as a career for them because we had old, outdated homes. So we're building them brand new homes, state-of-the-art facilities, so that they can be proud of the place that they work in, and they can be proud of the province where they are working, and we can attract people back here into the province of Ontario, and we will get that job done over the next number of years, and we will not stop just once this allocation is done. Long-term care will continue to be a priority for this government because we're going to tackle all-way health care. We're going to build healthcare facilities across the province because it is part of building an economy as well at the same time. You know, we lost that healthcare advantage that was so important to the province of Ontario to attract businesses and investment in Ontario. And when people decide where they're going to spend their money, where they're going to invest, whether it is in Ontario or other jurisdictions, health and education always is something that they ask about. And now we can turn to them and say, we're making the important investments here in North York, the massive investments that my colleagues announced yesterday. We have care, long-term care as well, and we are building an education system that is second to none, and that will help us grow and make sure that this economy remains strong and stable and prosperous for many, many years to come. So thank you all very much for being here. Thank you for listening to me, and again, thank you to my colleagues who make this announcement very, very easy, and to Bert and Karen. Look, we wouldn't be here if it wasn't for you, your team, and all of you here who make this possible, and thank you for allowing us to spend your money to make life better for our seniors. Thank
you. Good morning. And thank you for joining us here. I want to thank Minister Calandra and the Ontario government for this very, very significant investment in seniors' care. I'd also like to recognize MPPs Cho, Ke, and Martin. You are tireless supporters of our community and our hospital, so thank you. This is a historic investment at North York. In partnership with the government, our foundation, and our donors, we are embarking on the largest expansion of our facilities since North York first opened 50 years ago. Yesterday, we announced just yesterday, we announced the next stage we're planning to build a new patient care tower on this site. And today we're announcing a new, leading-edge, long-term care right across the street from here. The next chapter of North York begins now. Our new 384-bed home will be one of Toronto's largest long-term care homes, and it will be among the first to be built post-pandemic and will reflect the learnings from that time. Our home will be designed to promote the safety, well-being, and dignity of our residents. Our goal is to build a home that any of us would want our parents and loved ones to live in, should they need it. It will be located right across the street from the fully integrated and fully integrated with our main hospital site. This means staff and physicians will work at both the hospital and the long-term care home, providing comprehensive care to residents. Residents will also have access to primary care services within the home, which helps prevent hospitalizations. And our new home will be connected to an array of senior services, including our well-known palliative, geriatric, mental health, and reactivation programs, as well as programs through our OHT. Our new home will also include cultural amenities and meals to ensure that seniors from diverse communities feel welcome and at home. We are going to build something truly special that we're all proud of. Thank you once again for joining us here today for this exciting announcement for long-term care and for the next chapter of North York. We will now ask our President and CEO, Karen Popovich, to make some remarks.
Thank you all for joining us for this important announcement today. Minister Calandra, Ministers Cho, and MPP Ke and Martin, on behalf of North York General Hospital community, I want to thank you for your commitment to building this advanced long-term care home in North York. Realizing this incredible vision for a campus of care designed for the unique needs of older adults will depend on strong partnerships. We look forward to continuing to work closely with the government and the Ministry of Long-Term Care to bring this dream to life over the next few years. We are also eager to engage our staff and physicians, our community, patients, our residents and their families, and partners in our Ontario Health team to help build a home that is truly centered on what older adults want and need. Our foundation and devoted donors will be integral to both our hospital expansion and our new long-term care home. We are grateful for their generous support for North York General Hospital and the communities that we serve. I would now like to invite up Eva to facilitate questions.
Great. Thank you. So I ask members of the media if you have questions, if you can come to the microphone and please state your name and your media outlet, and the minister and others will take questions. Thank you. Holly?
Hi, it's Holly McKenzie-Cedar with the Canadian Press. I wanted to ask Minister Calandra about how the government's protecting the vulnerable long-term care population now that we're in what some people are calling a sixth wave, and it does look like cases and outbreaks are going up a bit again.
Yeah, well, look, we're gonna continue to do to work very closely with our partners in the sector. We're monitoring it obviously every day. We obviously there was going to be an expectation that as we opened up that things. That there would be an increasing in infection rates across the province of Ontario. But as Minister Elliott has said, we are well positioned and well prepared to handle what we are seeing. As you know, in long-term care, of course, a little bit different. There is still a masking mandate. There is still a mandate that you have to take a rapid test before you enter into our long-term care homes. But obviously, this is our most vulnerable sector, so we're going to make sure that that they remain safe. And ONASI has also updated its booster guidance, so we will have that as a tool as well. So I'm very confident that we remain in a good spot. We have to balance, and we heard this a lot, Holly, you know this, we heard this a lot. We have to balance you know, people's very important need to be able to see their family, and we want to be able to continue to do that. The vaccines for us in long-term care have really been a game changer, but it also is, you know, the IPAC funding, you know, hundreds of millions of dollars in IPAC funding, prevention and containment funding as well. So we're not reducing those investments to keep our homes safe. Just the opposite. We're continuing on making those important investments so that our residents can be safe in their homes.
And I wanted to ask about the nonprofit builds versus kind of, it seems like majority of these new projects are private or for-profit, and I was wondering if you could kind of explain it, kind of the balance of focus when we heard the Long-Term Care Commission describe kind of the worst outcomes for residents during COVID in private homes.
Yeah, look, we're going to work with all the partners who want to provide the best quality of care possible for our seniors, whether it's not-for-profit, profit in the municipal homes. what we heard loud and clear is there was a number of things that had to happen in long-term care. There had to be brand new homes. We had to eliminate the ward beds. We're doing that, and that's why we're making such enormous investments in adding long-term care beds. And we're as many new beds as we're adding. We're also upgrading as many beds. Frankly, we've understood how important it was for infection prevention and control measures. This was a lesson that should have been learned, frankly, after SARS. It wasn't. We are making sure that that remains in place. Prevention measures are going to still be there for a very, very long time to come. And we've, of course, increased inspections. We'll have as I said in my remarks, we'll have the highest inspector-to-home ratio in the country. But part of it also is, frankly, is the care, the amount of care. And we heard loud and clear that we had to get to the 4 hours of care. And to get to the 4 hours of care, you need to make significant investments in staffing. And that is why we are being so aggressive in bringing 27,000 additional healthcare workers into our long-term care homes. And I think we've got a good mix, a good number of partners. We're getting the job done again, I don't want to make it sound cliche, but I mean, these are people who helped build this country, and I know when we saw what happened in the first wave, we all knew that we had to do better, and we are.
Great. Is there any other questions from members of the media?
I would go again.
Oh, I have one. Okay. CBC.
Okay. Hi, Sue from CBC. On behalf of Lorenda Redicott, she asks, the head of the Woodbridge Vista Family Council has written to you saying staffing levels are as low as they were near the beginning of the pandemic. He's asking for a hospital to take over there. What is your government doing about the situation there?
Look, whenever we saw, certainly during the first wave, that this concept that the hospitals would assume responsibility. I had it in my writing in a couple of instances, and we saw how important it is. That's why we're building campuses of care as often as we possibly can. When a home reaches out to us, through us and through the Ministry of Health, we look at every single situation. We monitor staffing levels across the long-term care sector on a daily basis. Every morning I get a report on the staffing levels, the outbreak levels in a home, resident cases in a home. And if we feel the need to assume the responsibility, we are not shy of doing that. We've been very, very clear. This is our most vulnerable sector. We will ensure that residents feel safe in their homes. And we will continue to monitor that situation. But residents in not only that home, but in any home should truly feel confident that if the Ministry of Health needs to work with a partner, a healthcare partner, that we will ensure that we do that as quickly as possible when the need is there.
We have time for one more question.
Yeah, I was just wondering, following up on the question about kind of protecting people during this wave, because I think we understand that if there's more cases in the community, there's going to be more outbreaks. That's just kind of how COVID works, and your government's now kind of lifted the majority of measures outside the long-term care homes. It's only been a couple months since Omicron, where we kind of saw what some people would call an unnecessary wave in long-term care. So I'm wondering kind of how you justify to people that might have loved ones or people who might get infected during this wave. Are you really prioritizing their safety?
Yeah, look, Holly, a vast majority of our homes are not an outbreak. And I think you know that what we classify as an outbreak isn't necessarily residents who have COVID. It is one or two staff members. If they have COVID, we consider that an outbreak, and that allows us to provide even more infection prevention and control and other measures in place. But we also heard yourself and many others and other advocates in the system and people, residents in our long-term care homes say that, look, the last 2 years were very, very, very difficult for them. They needed to see their family, they needed to see their friends, they needed the government to respect that this is their home. And during the first wave, we did not have vaccines. Right now, 90% of our residents have been vaccinated. It is an incredible amount. It's not only residents in long-term care, the people of the province of Ontario, I think it's up to over 90% who have been vaccinated in the province of Ontario. We are also with NACI allowing for an additional booster shot. I think that will help. But at no time, we said, this is our most vulnerable sector. our most vulnerable people. That's why we provided the IPAC funding. We said we weren't going to reduce that just because we looked like we were coming out of COVID. No, we continued that funding. We continued funding for PNC. We continued the masking mandate in our long-term homes. We continued the rapid testing in our long-term care homes. So we're going to continue to do that. We'll monitor the situation every day, but it's been very, very clear, and I think the Premier has been very, very clear that we will take every step that we need to ensure that our most vulnerable are protected until we finally put COVID behind us. As we said, it's not behind us. It's not completely behind us. We're going to be battling this for some time to come, but for the vast majority of the people of this province, the time has come to move on and to learn to live with COVID, and that includes respecting people in their homes, long-term care homes, and allowing them to once again be part of the community.
What about, I mean, the question was more about lifting restrictions everywhere else though, because I mean, I think some people would say this has been kind of, it's not super gradual, you know, to lift restrictions in long-term care and then everywhere else in the community at the same time. It could kind of lead to a bigger spike than we're necessarily are able to manage. Like, I'm just wondering if you could address that.
Yeah, look, Holly, I think as the Premier said, as Minister Elliott said, as Dr. Moore has said, we are in a much better spot in the province of Ontario than we were at any other time. We have 90% of our people who are vaccinated. We have one of the highest vaccination rates in the entire world, frankly. We have increased hospital capacity. You know, I said this a lot of times in the House, and you've heard me say this. Ontario was brought to its knees because 800 people were in ICU. 800 people were in ICU, and one of the richest jurisdictions in North America, if not the world, was brought to its knees for far too long. That was completely unacceptable. And that was because previous governments failed to make investments in ICU, they failed to make investments in critical care capacity, they failed to make investments in long-term care. And as the Premier said, and I hate it, you know, as the Premier said, we can never allow that to happen. That is why we've increased ICU and critical care capacity in the province of Ontario. That's why we're making it permanent. It's why we're building brand new hospitals and adding on to these hospitals. We're tearing down old hospitals, building new ones, increasing capacity. We're making huge investments in healthcare and in long-term care because we can never allow a jurisdiction like ours to be brought to its knees because of 800 people in ICU. Our nurses, our doctors, they told us what we needed to do to make sure that we didn't lose the lessons of this pandemic, and we're not. And frankly, I'll say this and then I promise to stop. We knew coming out of SARS, it was made very clear what governments needed to do to ensure that in a broader, larger pandemic, we could handle it. The previous government, over 15 years, failed to do anything. Anything. We went into, sorry, this gets me very, very frustrated. We went into warehouses and found outdated masks and PPE supply. We had to go all over the world to try and accumulate PPE for our healthcare and frontline workers. That doesn't exist in the province of Ontario now. All of our PPE is supplied by people, by producers in the province of Ontario. We're doing everything that we need to ensure that we are never brought to our knees again because the governments didn't make the investments that was necessary to ensure that its people were safe. And I'm very confident that going forward that we not only have the capacity, but we have the resources and the people and the talent to ensure that we are never brought to our knees again because of poor decision making by governments. So, thank you again. Thank you all.